Good evening. My name is Michael Kidd and I'm the President of WONCA, our World Organisation of Family Doctors. Very pleased to be able to join you by video in this opening session of our 13th WONCA World Conference on Rural Health, being held in beautiful Dubrovnik in Croatia. I'd like to thank Tanya and Ines and all the members of the COHOM team for bringing everyone together for this amazing conference. Tanya tells me there are about 1,000 delegates from around the world taking part in the conference. I was hoping to be able to join you live from my home in Adelaide in South Australia, but at the moment it's 3 a.m. and Tanya was worried that I might turn up in my pyjamas, so she asked me to pre-record this yesterday. I'd also like to thank and congratulate John Wynne Jones and all the members of WONCA's Rural Health Working Party. Together you do an amazing job advocating for the healthcare needs of rural people living in countries right around the world. I'm sorry not to be there in person, but the WONCA executive is well represented with our President-elect Amanda Howe, our CEO Garth Manning, Member-at-Large Karen Flegg, and WONCA Europe President Job Metzemakers. And I hope that you take the opportunity to meet with the members of our World Executive and challenge them about the important work that you do. Our very first WONCA President was Monty Kent Hughes, and at the very first meeting of WONCA, he said that the future of our professional discipline will depend on our ability to work together in the service of humanity. And that's what we've been doing ever since. It's why our organisation is so important. And this conference, with its theme on breaking down barriers and bringing people together, carries forward that tradition of our global organisation. One of the privileges of being the President of WONCA is that I'm invited to visit family doctors in their practices in many countries around the world. And since we had our last WONCA Rural Conference in Gramado in rural Brazil, I visited a number of countries including Ecuador, China, India, Cuba, and later this month Ghana in West Africa, where I've been invited into rural practices to meet with our colleagues and to discuss the challenges they face in their important work every single day. You should all be very proud of the work that you do as rural doctors. WONCA is proud of you, and we're very proud of our Working Party on rural practice. 23 years ago, the Working Party was established, and since that time, it has been a strong and consistent advocate for training and support for family doctors working in rural areas right around the world. We know that half the world's population live in rural areas, and we know that half the world's doctors do not live in rural areas. The doctors in rural areas are you, family doctors living in communities, serving the needs of the people of those communities. And I thank you for the important work that you do every day. I'm also very pleased that at this conference we have many young doctors present, members of our young doctor movements, particularly the Vasco da Gama movement based in Europe. And I hope that you meet many of our enthusiastic young doctors and support them in their desire to train to become a wonderful rural family doctor as well. I'm also very pleased that over the last 18 months we've established a new working party within WONCA with a focus on Indigenous peoples and minority groups, led by Dr. Tani Taylor from New Zealand. And I hope that our two working parties are going to work together to address the often neglected healthcare needs of Indigenous peoples based in rural areas right around the world. The work that you do is important. I hope that you have a wonderful conference. I hope that you learn new things, learn new skills, have your attitudes challenged, but most importantly, that you make some new friends amongst your colleagues from family medicine from around the world. Together, we work together. Together, we support each other in our service of humanity. Thank you for the great work that you do, and have a wonderful conference.